Fortunately, the outcome was fine, but I mean, the moments immediately after administration and we realized that we'd given the wrong drug, there was a moment there that, oh my God, this kid could die.
Sometimes things that are important can get left out, and it's really unfortunate. We really do our best to make sure that it doesn't happen, but it's sometimes inevitable. And I think it's happened to all of us.
They didn't know whether or not a safety report needed to be filled out. I think they were worried if they filled out a safety report that somebody would get in trouble.
If you can imagine that the room would be loud, would be busy, people would be unsure of roles in some circumstances.
From 200 up to 250 patients in a day. It's stressful. It's really stressful.
The potential for harm is always there.
She mistakenly grabbed the wrong syringe and grabbed morphine instead. So my husband and I drove to the hospital actually thinking our baby had died.
Across Canada, 3 to 4% of children admitted to hospital suffer significant preventable harm.
We'd become used to the safety procedures, so it was shock, like how could this happen? How could this happen at the best hospital in Canada?
I mean, we've got all these innocent patients coming for care, and there's potential for harm. And so we've got to make sure that that just doesn't happen. Doesn't happen.
Safety is our top priority here at SickKids. We want to ensure that SickKids is a safe place for our patients who come for care and their families, and also for the staff who work here. Unfortunately, harm does happen to our patients. That's why we're working hard every day to ensure that this is a safe place to be.
Kids shouldn't get sicker because they're in the hospital. They come in with one thing, we don't want them leaving with something else or having to stay longer because we've done something that makes them a little bit more ill.
People have suffered from needle stick injuries, breaking an ampule, they've been cut.
Every day we put ourselves at risk working in a laboratory with different chemicals, different techniques. There's teratogens, mutagens.
We're exposed to everything under the sun basically here.
Most people think in terms of the patient, and that's number one, but without safe staff you haven't got somebody to look after the patients.
Improving safety is more visible and tangible with our Caring Safely initiative. We have identified how we plan to improve safety and eliminate preventable harm.
These are our objectives.
Reduce the incidence of serious safety events by 2/3.
Enhance our safety culture by adhering to the principles of high reliability organizations.
Reduce the incidence of 7 hospital-acquired conditions.
To improve staff safety by reducing the injury rate by 20%.
We are joining a North American network known as the Solutions for Patient Safety. This is a fundamental part of caring safely, but we will also be addressing and placing great importance on local problems. We're actively engaged in solutions that involve parents and families and the patients themselves.
We have a morning huddle with the staff in regards to safety. Then we meet with the leadership and have status sheet safety rounds. And then we know that anything that doesn't get caught can go to the executive in the morning safety call.
Good morning, everyone. This is our SickKids Daily Safety Briefing. We may have...
Having been through this whole process, I actually feel like SickKids is an incredibly safe institution. It was just simple human error, and unfortunately, that happens no matter where you are. You never want it to, but it does. And I think that every mistake like this is an opportunity to do better next time.
Caring safely to me means that my staff have what they need and are supported to do their jobs.
We think not only of caring safely for patients and families, but really we need to care safely for each other.
The narratives we tell and what captivates us are really the big stories. But there's just as much opportunity to do things every day. How do we reduce error? How do we improve communication?
First thing I say to trainees, I say, you know, you've got to be on your front foot in this hospital every minute of every day that you're here. Be prepared, and finally, when in doubt, shout it out. You know, we're in this together. It's not you or it's not you, but it's us providing care for children.